All right. Let's see. There we go. Can't change that now. Anyhow, I was in the background of a whole nother studio. And I'm about to bring up and start for you the number 13 of Paradigm Shift. Thanks for joining us. And hope you catch what it is I'm laying down for you to understand here. I think I've got right there. We're going to go transition, and it should start playing. Oh, I need to.
I think it's going. We got the 30-second delay.
That's like that. Oh. Here we go. I don't have chat. What's going on? Why don't I have chat? I'm going to try. All right. So I'm going to turn this down and leave to that for an hour. I don't know. I have no idea. More than loyalty. I'm trying to figure out. Oh, hey, look. It says 7 people are watching me. I'm going to go into reverb mode here and see if I can't get chat up so I can communicate with y'all. What's going on? Why don't I have chat? Let's see. So I go here. I'm going to go here. Try. I'm going to go pop out chat. Okay, I got one. Am I going? And I'm closing this window. I don't know. I have no idea. More than loyalty. Okay, let me come back out to the studio. Cool. Got the stars for you, at least. I got some chat over there. It's kind of behind things. And good morning, good morning. Blessings upon everybody. May my thoughts come clearly to you today so you might understand what it is I'm telling you. I have to say. Hope you all had a great first week of the year. And again, thanks for joining. I'm going to let the cat out. It's dawn right now. It's 20 degrees. I killed a jade plant because it was like 80 yesterday and I left it out. How does that work? I don't understand. But the Hindu Kush, they're surviving out there. I'm going to see if I can pull that back up to the surface. And it kind of hides me a little bit. Great to see you guys. Studio mode. That's right, baby. What's up, guys? Let's see. Appreciate y'all. I see Squishy Mirror is talking about NIH document titled Cannabinoidal inhibits SARS-CoV-2 replication. So that's another show. I'll take a look at some of that. Thanks for pointing that out. But there is a lot of things that go on in the lung, and that's kind of one of the things I'm going to hit on, or really want to hit on today, is what's going on in the lungs. And so, like,
coming up on here.
I started administering cannabis as a medicine in the mid-'80s, and there was very little that we knew about. And I can see my house from here. That's in the chat. That's funny. But one of the big things was the debate over what it does to your lungs, right? And so we had there's one professor at UCLA studying the effects of smoke on the lungs primarily, but he was like the one guy that we really had information from back in the day that we knew about. And the biggest thing I remember, and I started looking for this, and I'm gonna have to look further to see if I can't find it, but it was.
I'm going to do a little bit of see if I
can. How do I put it?
Chat. I don't know why that's not.
He was talking about smoking,
get a little reverberation.
And people who've smoked chronically would understand what I'm talking about when we have lung expansion. Okay, and not every cannabis plant does this, and it does it in the bong really well. It kind of replicates like you're having you might feel like you're having an asthma attack almost, right? Well, the one thing I remember, and I didn't have enough time to really research this, or I didn't spend enough time. I should have spent more time looking for this to present it properly. I recall him saying back in the mid-'80s was that
So I got that stopped. I got
that
popped out.
condition literally would acutely reverse an actual hardcore asthma attack as it was happening. Okay, and I know this sounds totally counterintuitive and everything, just like
I realized,
but when I'm
a couple days ago, or after that last show, that I kind of
I want that'll come back later here in this discussion, right?
It's like a bunch of beginner skiers came up, said, "Hey, can you show us how to?"
A lot of the stuff that people were frowning against were saying that smoking, and we still say it today, that smoking is bad for you. It's not good on your lungs. It causes different stuff that's not happy with what's going on. The science has progressed considerably since the mid '80s, and they're like, you're still looking at this stuff, and it's like, yeah, that really it might contain some carcinogens, but it doesn't really appear to be causing cancer for various reasons. There does seem to be a change in morphology in people's lungs that smoke a lot all the time.
Studio mode as
so
well.
there's
So yeah, like I was saying there,
different. There's different ways of administering the cannabis, right? And it does different things when we administer it in different ways. And so,
hey, how do I get to here?
A lot of the effects that they're studying are long-term heavy use effects, right? So, like, I was born smoking tobacco, and I smoked up until
I've had that for 20-something years.
26, 25. But I quit at 4:20 in the afternoon one day and right up a ski lift and threw my cigarette off and lit a joint.
It was reiterated a couple times.
I've not smoked tobacco since. I can't smoke blunts. I don't like being around tobacco. Bronchodilator. Yes, that's exactly what.
It's all hand painted and stuff.
That's exactly what I'm alluding to, and I couldn't. I want to find that, and we might find it here as I searched through. I brought up several pages, Dr. Taskin's work and such. It's a vasodilator as well, right? So it opens up bloodways. With the proper THC CBD ratio. So we touched on that last week, right? And I brought in making the different. We were talking about different forms of administration.
I said all those things, but I didn't really
very small quantities of THCA or THC delta 9 doing different strong effects for people, and so hitting it right, like in this particular instance, I'm alluding towards the cystic fibrosis, okay? And so in that particular disease, see here, I'm going to go ahead and bring up some screens, and so I'm going to bring things around. Let's see, I'm going to go ahead and transition there, but I don't think that's what we have on the... Oh, it is.
I'm able to send Peter.
Let's go ahead and look.
Right now, like 30 different varieties at the
got the right one? No, sorry, I'm going through. My daughter's Snapchat got disappeared, and somebody.
We might get up to 40 or
ripped this off.
Probably 100 different.
Dr. Taskin's. Oh gosh. Oh no, we're right over here.
Like there's probably about 100 on.
No. I'm sorry, I got this stuff all over the freaking... Here's one. Okay, so what terpenes open the lungs up? What is it that causes the vascular dilation?
And I need to pack one.
And so quite often it's the pinene that we're going to find in there that's going to do that. And
let's see, I'm going to go ahead and...
I think you all should be seeing that at the moment. The name gives the terpene away. Pinene is found in pine trees. Produces that same crisp, similar scent. So you can use this as a... essential oil as well. Like I use it to, and I'll just wrap it on my forehead a little bit once in a while. Okay, so where the heck is the page I'm looking for? No, not this again. Not this again. I'm sorry. I thought I had this stuff all brought up to the forefront.
So we were looking at migraines, right, and all the different things that might cause them.
Here we go.
We might attack them, and we were looking at.
Okay, so cystic fibrosis. It's caused due to a genetic defect.
Where'd they go? This is interesting.
Symptoms include difficulty in breathing, coughing, and poor growth. Cystic fibrosis cannot be cured. Several treatment options are available. Help manage symptoms and reduce complications, although incurable medications help in managing symptoms.
Some of the small little flowers, and I wish Brother Bone was here
to chat up if I can.
Right, but it's crazy because they are the exact same.
Yeah, sorry. I can't spell. I'm highly dyslexic, and I didn't have a chance to go in and correct in the studio. There's not a spell checker, so I will fix that. Appreciate in chat pointing out I can't spell for shit. I know that. I made it through college though. Professors realized that doesn't affect my ability to understand what we're talking about. Right? Just
we can
whatever my brain is wired weird.
Charts, whatever, but we can also ask questions of which terpene.
I can't. Let's see.
Right?
I can't read what I'm seeing there.
I'm just touching.
So symptoms:
bringing up some different charts.
cystic fibrosis affects cells that make mucus, sweat, and digestive fluids. These fluids are thick in CF patients and cause the blockage of ducts throughout the body, leading to a range of symptoms. The lungs and digestive system are the main areas that are affected. Symptoms may appear soon after birth or in early childhood.
Kind of sedate yourself and just
in rare cases, they are not manifested until adulthood. Okay, so that reminds me of one of the other things I wanted to bring up about. So when we look at different types of cannabis and what we're treating, or how we're going to treat it, or if we're actually using a plant, or if we're going to use extracts and apply specific amounts of different things to our
the main thing I want. So with CBD, it counters
to our patient's medication. Right? Okay, so we see pinene helps open the lungs up, but like limonene, like for me, causes severe cotton mouth and drying of the ducts, right? And so that's one you want to avoid because it would have a antagonistic effect on the system. So, but some of these things that we see is persistent cough with phlegm, postnasal drip. So, and again, postnasal drip is cleared up from the limonene. And so possibly a direct application instead of into the blood, but as a nasal mist, all right, sinusitis. And there's these different different stuff that's going on, right? That you would look at, and how do we go ahead and help?
I wanted to talk about the terpenes
different
that I had found in that conversation.
Things that these people are dealing with, right? So antibiotics are given in the form of inhaled therapy to improve lung function by impeding growth of bacteria. Here's a crazy one that I kind of trip out on, because when I was studying like cartridges for vape, I found
whether it's the
an obscure study that seemed to be kind of repressed, but
antigelistic and synergistic.
Looks like I'm having connectivity issues.
Application, and so one will increase something, one will decrease.
I found that the stuff, the carriers that they use for vape cartridges, whether it's just like flavor vapes or whatnot that the kids use, or some people were utilizing, and I employed it for to work in the super cold.
Again, like with the CBD, it was totally counters the effect. And when I first experienced
it's the I'm sorry.
CBD THC strain extract.
I apologize. I didn't even think I was going to come to this. So what are those called? PNGs? No. They're this carrier. They're from the food industry. They're clear fluids. But anyhow, the freaking.
I don't know if this is the best analogy, but I thought
one of them was like an antibacterial, and the review I found was saying that like by now, and so this is like 8 years ago or whatever. By now, we would have all of our vaccines and all of our medications would be administered through vape pens, utilizing this stuff because it's an antibacterial. And I could run down in the garage and grab a bottle of it and see the name. I can see the bottle. I can't apologize. PG,
and a good
TAG. I'm sorry. Anyhow.
Description
I
of it.
think you might know what I'm talking about, and it'd be an easy thing for me to do search. But so anyhow,
I had a patient who had severe back pain. He came
administering medicine through the lungs,
gray in the face, sweating, just like, dude, I need help bad. And
as an antibiotic. Okay, so cannabis can be an anti-inflammatory, and that's to help to keep your lungs open. Right? We have pinene opens up the lungs as a vasodilator. Right, mucus thinners, and that's when I'll ask about. But bronchiodilator, right? So we know that cannabis can be a bronchiodilator. And so it's a matter of finding the proper way to apply. Right. A whole nother one, oxygen therapy. I think everybody should.
So the chemistry of these things has.
So these are the thought processes that I like to think about when we're looking at what it is. These different things.
Man, I wish this chat here was.
So here it asks, can medical
what I wanted to do, and I brought a couple of these other ones.
Marijuana help cystic fibrosis sufferers? Despite the lack of research in some areas of cystic fibrosis and medical marijuana, there's sufficient research on medical marijuana for other diseases to support its use for cystic fibrosis sufferers. THC is the cannabinoid often associated with relief from cystic fibrosis symptoms. But again, so it doesn't say how people are using it there. Here's a whole thing on medical marijuana for cystic fibrosis for doctors.
So we've got, I kind of want to, I'm all of a sudden I'm seeing all sorts of charts off of the side.
And it says we may find some relief.
What is this stuff? Let me do this. Transition to there, and then I'm going to do, what is that?
Here's some stuff probably on Reddit maybe with cystic fibrosis symptoms help. We're helped by my edibles. Cystic fibrosis. So there's a whole bunch of questions again, and so it says there's probably groups on
fellow approaches. Says, man, I heard you talking about how you could help
Facebook
with MS.
And so here's PubMed. Let's take a look at what they've got.
Montel Williams, who has started a company because he was using black
shrink. Yeah, let's see what's going on. And at the time, medical marijuana and cystic fibrosis is unknown. Through the use of a survey, we aim to clarify rates. Methods anonymous survey was sent out. Okay, so a total of 637 surveys.
There's going to be groups.
This was so they sent out to 6 centers in the Mid-Atlantic region of the United States. Use and reason for medical was assessed along with received. So this was just a random outreach, not necessarily cystic fibrosis patients.
Right? You don't always need a whole lot. I'm going to
go
back to.
It doesn't say that in the methods exactly. So yeah, the title is cystic fibrosis. So that's what it is.
You can't see. You can kind of see how light that is. This is a coconut oil cream.
Results,
see if I can't put it in
28 out of 30. So the most common indications were for pain and stress. 28 out of 31 found marijuana to be great, effective.
Here we go.
See, 31.
Okay, so you can see very light, and it has actually, what do I put in here?
Pretty simple. Conclusion: the use of medical marijuana for reasons was 15% in the past year in the sample of CF population. So not many people are trying it. So there's not a whole lot to see what's going on, right? But the majority of people who are finding relief from pain, particularly. Okay. And so all this stuff I'm talking about is probably not even thought of being, looking at the different aspects of the plant when you have these different types of
25 or 50% for cancer patients.
And we have these different perspectives and understandings of the complexity of the plant and how antagonize or synergize when you utilize the knowledge and understanding of the terpenes in the endocannabinoid system. All right. So talking about normal. I am completely abnormal because I don't have a single tattoo on my body.
Originally,
let's see. You guys didn't get to see that. Here we go.
Okay.
I'm gonna go.
So the way people got around it was
I think I have.
They evaporated out all the.
Here we go. Transition. Oh, it's not even going.
Cover it with an inch or two.
Why isn't it going?
Evaporate the water off as well, and so that would always be activated because
it's not going. I don't know how to get that one. Let's get this one going. No, let's go.
What we would not accept today through any.
See, there we go. All right.
Talking 35, 40 years
ago. Transition. Okay, I'm live there. All right. What's normal? I don't have any tattoos on me. I have scars inside. I have no spine like a 90-year-old. That's normal. Was it normal for me to go hike up the side of a mountain yesterday and slide down the frozen face on 2 sticks attached to my feet? It's about all I can do. That's what I live for primarily.
And so,
my normal is to go skiing. Most people pay for a pass, and I don't need to ski in
the different amounts that you
that's the wrong thing.
Is such a
THCA is a substitute for steroids for inflammation. No, man. Okay. So squishy mirror, yeah. THCA is like one of the best. I've been preaching this for years. It's the best anti-inflammatory, like minute amount in the topical.
The same strength as this topical, which is nothing.
Behind the magic curtain. is
if even.
my
Maybe
topical.
long.
You can see it's so
I don't
bright
know.
because it's mostly
It's not-
coconut
there's-
oil.
It's such a
And you
small
just see a little bit of green
amount
tinge
that
to it.
does so
I
much.
wasn't getting the other
when,
plain, the
it's like a
non-cartoon
microdose, we call it.
character
So it
filter
doesn't necessarily
can
need to be
work.
this
Let's see. I'll try that
massive
again.
quantity that's doing the job. It's got to be
It's
formulated correctly in the proper
Anyhow.
acid or not acid form for whatever it is that you're looking at, right? And then
Anyhow, yeah,
you
so
need the
that's like a
terpene
teeny amount in there,
fibers.
THCA
And
with
so
chlorophyll and everything, and it totally
And so a
um,
whole nother thing that I wanted to
does
touch on today,
amazing
and this is going to hit on. If I don't
anti-inflammatory
get into
and whatnot, and utilizing it
topics I
orally.
wrote, this is all part of the same
THCA
thing.
is the bomb,
This is actually
right? And so the majority of people that are taking edibles are consuming baked goods, right? And that's got Delta 9. And so there's this whole other world that people just don't freaking catch as to what's exactly.
These different titrations,
Why am I not
you
moving?
figure out exactly.
Move
And this
the
is where
screen around. There we
going
go.
with kids, it's a little bit
Read
tougher
you
to start
guys.
on the smallest end.
Yeah, the prednisone is like not even like a painkiller, and they totally freaking. It's like I think Canada is one of the worst places for it, but there's a ton of people here in the States that that are using it for a painkiller, and it's just
They only did it for
it's
like
like
2
no,
weeks.
you should be doing like
They never changed the
yoga on some of
titrations.
this
They never
stuff and
tried
THCA and
any
THCV for your nervous system.
And they just noticed the same
And
thing
applying
that
the
you see
terpene
in
ratios that you understand
and so
are
that's
going to
something
work a
that you have
lot
to be aware
better.
of as well. We all build tolerance and
Balm of Gilead. So,
tolerance and-
right, even better.
But
I really want to see if I can get this filter turned
yeah,
off
Primo
here.
over
What's
here
going
chat
on?
on the home channel.
Just
in
not
studio
sure
form,
why.
Stating
Because I want.
that we have CBD and THC both increase the effective.
Okay, wait.
maximum
Let me
dose
try
of the other,
this.
Right,
Where'd it
that's
go?
what I've said. They work as a fulcrum and a lever.
That's seen.
So
That's
each alone,
seen. All right.
You can use one as a wedge.
Let's
you can use
deactivate.
one
That's
as
what
a
I got to do.
five-bar,
All
or
right. So
stick.
then I got to go.
But you put those together, you can move
No.
tons.
Deactivate that, and then I can
That's the
go.
difference. You can move pounds. You can move tons.
No filter cam
and
should
so,
be. No, it's not.
And I'm sorry, I'm not seeing the.
I'm sorry, I'm
chat
trying to
message
get this
from,
to-
the
I-
channel right now and
something's
remember
messed
that,
up
so I
here.
apologize.
Anyhow,
Messed
this
up.
one here is the Cannabosin oil. All right, you can see down at the bottom, it's got a heavy blob
Again,
of
so with
stuff in
different
it,
titrations,
and what
you
that
don't
is
need to just
is
get blasted. You can
uh,
also,
a mixture
you can
of
synergize
cinnamon.
with the CBD.
Here,
Talked
there it
on,
is.
I touched on it last week. That CBG may
Frankincense, myrrh.
like
It's in virgin coconut oil and olive oil. And this one can be taken as an edible. There's also
understanding of it. Everything I've heard from
it's probably a 5% by weight
phenomenal, and
with the
but I
black
can't
hash
touch on it. I
oil
haven't-
or raw fico.
right? There's a
This
lot
one
of
here I
things that
heat up
don't-
though so it's activated.
Like I just made my best.
And this has got to be
someone doing a demonstration of this.
one of the most potent
Pale, white,
medicines
massive
I've ever
amounts.
created. I
Still
hardly
just-
use
still-
it when I'm
still
really
do
sick. I'll
the
take a couple
arts,
drops of this.
Right? But there's
But
other
this
things
is
I have.
what is proscribed by Yahweh or however you
so
want to
again,
pronounce it
we're
or
going
whatever
through
you want to call the God of the Old
different
Testament
amounts of CBD,
to
THC,
create
THCA,
the holy anointing oil
your metabolism,
and the
okay?
part of the preparation for the
these
Holy of
different,
Holies and
so
being around the Ark of the Covenant and everything was
was
this very similar formulation to what I'm
and
utilizing
the-
here.
Like my buddy who
and,
passed away, he would just smoke.
It's kind of the same
We
stuff.
didn't
I believe
understand
that
then
the
really
Jesus of
what the
Nazareth
power
was
of the
using
pico
to heal
was. I'd
people.
still already been
That's
making
all
it for,
just backing up the. There's some
making it close to 20 years before
Jewish
he passed away.
scholars.
We
These
had no
they're
idea.
they're
We're using
hardcore dudes about their history and
right?
faith,
Massive
and
doses.
they're all about the etymology. And I'm about the etymology. If you followed my shows or go back to watch the beginning,
Soon
the
after he
entire
passed away,
paradigm shift is talking about word structure and origins.
Usages of that for him.
And the
He had severe
etymology of
whole
the
body
Cannabosin and the
cramp,
sweet cane
he had a-
and
he
the
had an
translations
internal
through Latin and
pumps.
Greek
And
out
I was there one
of
day,
the old Hebrew and the sweet cane, and they're saying, nah, this is cannabis. And there's no two ways about it. And that's what these guys aren't potheads. They're not trying to advocate marijuana or getting high or dabs or anything else like that. They're just saying this is the actual word translation and where they screwed up over time.
dose.
Okay, and this is how, however, it became to be known as the devil's lettuce is just beyond us because of the fact that it's truly just
and that's a
this is
rare
something
case
that's
of
been around forever as a medicine and
whatever. It's all
that splat.
part of the reality, but he wouldn't.
Anyhow, so yeah, that's a great formulation. Again, it's an antimicrobial. It's that's probably the frankincense and myrrh are incredible antimicrobial.
One of my big things is
super potent, and they kick in all of your body enzymes
extract. Let me get back. I mentioned I
just all your entire system. A couple of drops of this stuff, and I just go whoa.
Than alcohol, right? Alcohol is the preferred method, and you make a tincture.
So those are good things to touch in on.
And it's in suspension.
Of course, all organic if you can make it happen, and what for not.
And so different people are going to use
Let's
it.
see, where was I going to go now? I'm going to go back to. Bring the web browser into the queue, and I'm going to see about bringing up. Let's see, let's take you back over here. We're going to look at a couple of little historical neat things here.
If you don't understand the laboratory science about it, if you don't understand what a polar solvent is, you don't want to go in.
This one. Here we go. Cool. All right, I'm going to do a little review, and I just did a quick review of this one. I don't know if I've seen this since the 80s itself, if even. Here you go.
The alcohol, the grain alcohol, if you can get it, is
cool.
the way to go.
So they've known it's medicine for a long time, and there was like this is originally like I believe Nixon started these
residues and whatever
research, and he knew this stuff was good for you. And it's kind of screwy that they went ahead with their war on drugs and said no, we're going to use this as a political ploy to be able to get.
A whole different world now.
And so
machines where you put your coconut oil into it.
Let's see. I wonder if I can do. I'm going to close my page down and leave this
no burning yourself
open.
on hot,
See if I can
greasy
pop that up.
Stuff wrapped up in a
shrink
bandana
you down a little.
or nylon.
I'm just arranging my desktop so I can
boil it and
do all this at once.
put it through nylon to bring it out. And
so what do we have here? Marijuana research findings in 1980.
So it's pretty awesome that you have these tabletop
NIDA
operator things, and you can.
We all know about the horrible, and they're still using the same weed they grew back then.
Where I'm going with this,
right?
was I'm talking about the heat, and when I mentioned this before in the
So
early
names:
90s,
Goldstein, Jaff, Jones, McLaughlin, Mendelson, Nolis, Robertson. I was looking for, like I said, the research from Tashkin showing about vascular dilation and helping. U.S. government does not endorse or favor any specific commercial product or commodity trade or proprietary names appearing in this publication are used only because they are considered essential. And we're not going to look at a whole lot of this. Forward, 1980 X marks the 10th anniversary of the Marijuana and Health Reporting Act. Right, so for 10 years, Nixon totally started this in 1970. Which called for the annual reports for the Congress on the health consequences of marijuana use that are transmittal accompanying the first marijuana and health report expressed the conviction that the reports would prove to be valuable tools in public education debate concerning the health impact of this widely discussed drug.
Like it's literally
76th edition of the mandated report for Congress and the public.
It's almost the same thing.
The National Institute on Drug Abuse published a monograph intended for readers who wanted to pursue the subject in great depth. So they have an audio
healing thing in itself, right? So if you can keep that intact, along with getting some
this edition reports through 1979 have been reviewed by 8 scientist authors. Care's been taken in reporting. So if you don't know, this is supposed to be government propaganda against cannabis. Okay.
Or whatnot. Now I just had an amazing thing.
But it was also like you can't hide the truth.
Discussing seed stocks, and he was having a hard time with this barley, and I was trying.
So we're just going to look at the context here real quick and roll through it. Marijuana and health, executive summary, nature and extent of marijuana use, survey, update, human effects, therapeutic use, effects of marijuana in combination with alcohol and other drugs, hazards of marijuana versus other recreational drugs. future
I
directions,
thought I lost
human effects and overview,
Nothing in the jars.
the
bro.
drug, botany,
I
and
have a bunch of
chemistry,
these.
assay techniques, dose considerations, general psychology, effects in humans, psychological effects, physiological effects, cardiovascular effects, respiratory and pulmonary effects, neurological effects, cannabis and psychopathy, motivation,
And that's all you have. You don't have a really
couch
nice
lock,
high-end juicer.
tolerance, independence,
You gotta
and
chop that
references.
stuff up because the fiber will destroy
Okay,
your
well,
shit.
you know, it's like we all think this is all like new research, and they're just hiding it from us
And-
for a
and if you
long,
can do it
long
with the whole
time.
flower, it's a whole
Um,
thing. I've never been able to pull that one off myself. I know people who do that.
Gosh, I had it set up where I
Shout
could.
out to a
Oh
friend
no,
of
I need to set it up so I can do this.
And,
You guys can see my ugly mug
there's,
while I'm talking too.
But
Acute
in
effects
that
of marijuana on
live
human memory and cognition, cognitive task, memory task,
essence of the
marijuana
living plant.
intoxication-free recall, marijuana
Again,
intoxication,
doesn't matter what your
free
element
recall
is, if you
flowing,
can consume
non-drug
the whole
learning,
living plant from your garden, right?
intoxicated
You can't do a whole
learning.
garden. It doesn't
What's the
matter what
difference
your
in getting
element is.
high
If
and not
you
getting high when you're studying
get
for
yourself a
college?
little microfarm growing microsprouts.
Recognition,
Okay, and you
memory.
need
Oh, they didn't do it with
whatever it is,
coffee.
something
I found a
that's
great
spicy,
effect of
something
coffee
like
makes a
all
huge
that
difference
is
in
You
there.
get that life force going into you. Okay, and so that's what's going on. If
Chat
you
up.
can
What's
keep
good?
it
People
low and
chatting
slow
like
and cool,
crazy.
when you do the extractions for a juicing,
Talk about Atlantis
or
in the
whatever
chat.
it is to get this plant
Epic.
as medicine for.
All right, so
Isn't
here we are. There's a big one. They used to want to say that
um,
made you sterile to smoke
more
cannabis.
there's endocannabinoid system
Effects of
imbalances
marijuana
with
on because I remember that. I remember in Dare. That's one of the most memorable parts of growing up and going to junior high school was health education from physical education, and they did like 10 days or 2 weeks of Dare, and they show us videos of hippies like playing volleyball, and the women didn't have their shirt on. They told us it was men who grew boobs, and that the fat guys were women with hairy chests. And all right, so this will be interesting to see. That's on page 137. I just want to skip down there. Let's see, can we skip down to
allergies, right? But I had to stop
137? This is just fun.
Beers. It's
137.
not the value and the enjoyment of sipping that isn't worth this headache increase.
Interesting
that I
to see
get
what they say.
Unless I go and take a pill.
Oh, we got a
Whatever,
few more
save the money
pages.
too.
A few more pages.
So what I'm saying though is the synergies of whatever it is. Okay, so you
All
might
right.
have a condition.
The effects of marijuana
but
reproduction
with having
in the year since effects of marijuana
um,
reproduction. Let's
endocannabinoid
see.
system.
Bat and
on
mouse
all sorts
testes
of realms, and
response.
So this comes to
List of species studied: rats
the
dogs, pigeons.
My understanding of it is that it's not just
and
our
humans.
cannabis intake itself, where
The effects of marijuana are
it's
observed in all phases of reproductive
flavonoids
physiology,
and
including
colors
decrease
and
in the weight and
food,
functions of the
period.
organs associated with reproduction,
So
and
cannabis is
decreases
like
in
you got
hormones that
fruit.
control the
There's
development of the
actually
fetus.
receptors that fit
These
in the
changes
brain
may
and
be
everything,
caused
right?
indirectly
There's
by
that stuff
alteration
for
of circulating
CBC
hormones
and
in
all
blood,
this stuff.
directly
But there's all these other
by an
terpenes
effect,
and
effective physiology
flavonoids
active
and colors.
ingredients in marijuana
All that stuff
reproductive
exists in
structures,
all the rest
or
of
by a
the food
combination of
process
both and
for the
indirect.
most part in our
That's
society
funny.
here in the United States.
Because I tell you what, it didn't
No,
stop
I
me
don't
from
know
getting
about it.
someone pregnant.
There's a lot of places that
I seem to be much hornier under the
very
influence
well.
myself,
Because that's just
and
that's
et
the
cetera.
system. We have our system is processed in supermarkets, canned food since the World
there are other
War II.
reports
We're starting to get
indicating
better
the
and better
quality
at
of
everything
sperm
else,
is
right?
affected by
It's
cannabinoids.
hard for me to
There's
understand
semen
because
of
it's
mice
come in scales,
treated
and
with
sometimes
THC.
It's a lot cheaper and a lot less energy for me to buy.
They were doing
packet of
5
high
and
grade
10
organic
milligrams per kilogram
$2 a meal
for 5 days.
and try and cook it myself, right? And that's
So they had CBD,
all that stuff, and that comes right back to
10 and 25 milligrams. But think about
You might have
that.
to go to get it from
5 milligrams per
might have to
kilogram.
do,
Could
like,
you
I
take 5
first
milligrams
treated a cancer
per
patient,
kilogram of your own
and
body
this
weight?
isn't how it is.
So
I
if
had
you
to
weighed
get on
100
a
pounds,
bus in downtown Los Angeles and buy from street dealers
that would
who were
be
connected to the cartel to buy press weed.
50 milligrams?
And so again,
There's someone
that's
to
not how this is done.
I can't
You
remove
reach
that.
out to
Someone
all
needs to
sorts of
remove
channels,
that.
again, through
There's
also shysters, right? If you're truly in need, you should never have to
yeah,
spend,
100
you should never go out.
100 kilograms would be that's
good, clean, organic material somebody has.
that'd be yeah, 50 milligrams. That's
in
a
your
lot.
local area,
Not micrograms.
right? Et cetera.
So yeah, you take that much, and that's gonna mess you up. It doesn't matter what it is, who you are. Anyhow, that's not what I was after today. Let's look at some more of this.
The chat over here. Bring that. Oh, here we got it up on top.
Oh, hey, okay, I'll use. I really wanted this to smoothly flow today, but no. Alex is a bumbling idiot.
So there's a fella I know from
Let's
the local
see.
chocolate shop when
We were
I
just
decided
going
whether
through.
we hang out in the chocolate shop, then
There's okay.
to a therapist.
You can see some of the heavy dosage they're putting to mice. 10 milligrams per kilogram
Oh, someone
weight.
blocked that one.
Effects on cannabis in
There's,
combination with ethanol and other drugs. Therapeutic aspects. Open-angle
owner
glaucoma,
of the shop
asthma,
says that
anorexia,
we have
nausea, vomiting,
mental
and cancer chemotherapy.
issues.
Irradiation and anorexia
And he was
nervosa.
fine
Epilepsy, retardation
till
of
stress
tumor
hit,
growth.
and his mind
Antibiotic
was
action,
stress.
anti-anxiety,
It's
and
like a
sleeping-inducing effect.
Somewhere around
Muscle
there.
relaxant.
Just like
Pre-anesthetic,
functions
pain,
as being
depression,
here.
alcoholism, and drug dependence.
And,
I
like I never
mean, this shit, that's the stuff that's like
figure out the formulation to help them out exactly.
the majority of this
you know,
was focused
help them was,
on. We're trying to prove it's a bad drug.
milligram
The first 185 pages,
THC in a lemon drop form.
and
He couldn't do it any other way. For
Here
whatever
we've got
reason. It's bizarre because like she owned a chocolate.
the last
chocolate shop.
15 pages dedicated
A lot easier if I
to
could just make a
why
chocolate.
it's being a scheduled
But
drug
yeah, so
is
that's
totally
literally-
unconstitutional.
And he became a highly functioning like
Um,
dude running the show.
Let's take a look at
Yeah,
that, though.
Right, with just one of these little things, and one was good for.
what
a
did
week.
they say
Literally,
back
it's
in the
all
day?
Small. Some people's microdose works that way. Right? I'm gonna go back over here and bring us back up to looking at MS. So
Summary.
I'm gonna look at that too.
12 categories of symptoms
You
or of disease states have been considered in relation to a potential ameliorative effect by cannabis or one of its derivatives. To summarize the state of the art insofar as the cannabinoids' role in therapeutic agents is concerned is difficult, but an overall impression will be attempted here. Not only the effectiveness of the drug, but also the need for new treatment products will be considered in the evaluation. Glaucoma. An acceptable topical preparation will benefit certain patients not helped by the conventional medications. It will have
figuring out
to contain less than 0.5% delta 9 THC. A superior synthetic analog may be found. So anyhow, that's saying how small of a content that can help glaucoma patients. Asthma, elucidating the mechanism of action of the cannabinoids be more important than attempting to produce a non-irritating elucidating the mechanisms of action of the cannabinoids be more important than attempting to produce a non-irritating aerosol. Whatever that means, I'm pretty sure it's saying it helps asthma patients, which I was alluding to earlier. Antiemetic. It appears that cannabis has a definite but not invariable anti-nauseant and anti-emetic capabilities. It is at least comparable to our standard anti-emetics and may offer relief to those who are currently not benefited
So
by
that's
them.
the main thing with it.
So a combination
But
of
again,
cannabis plus standard drugs used for vomiting should be tried
without
in
knowing
future
the
studies.
whole thing. So we have
And
the
so that's
anti-inflammatory. So
what
we're
I
looking at
first
the
use it
balance
for
of the CBD
treating
versus the THC,
seasick
then, like I was saying,
cancer, seasick landlubbers out on the fishing boats in 1985 was to stop
I know
them
he
from
was
blowing up
wasting
and
away pretty bad.
calms so much of your nervous
you can
system.
increase,
Epilepsy, cannabinoidal,
appetite
CBD,
with cannabis as well.
derives
but
further
not
clinical
all
trials for
cannabis
humans.
does, and so if I'm not
So I didn't even know
mistaken,
about CBD
there's
really
definitely
until
some
the
strains
mid
that cause
90s. I don't
munchies
think
more than others, and
this
I
stuff
have
was
no
all
idea.
hidden from us. Tumor growth inhibition. Although of interest, it does not appear that the cannabinoids will make a contribution to this area. What may be concern? So we need to go back and look at what the studies were doing. What may be of concern is that tumor growth inhibitors are invariable cellular toxins to normal cells, depending on the dosage, since they interfere with cellular metabolism. Therefore,
the
delta 9
balance.
THC should study
So one
further
thing
for
that might-
possible
with the migraine,
cytotoxic effects
that's what I
in
was thinking
dosage
back
levels
there.
used by
One thing
humans.
that might
So that's one
keep
thing that I
your
definitely have always stated, that we knew
blood
back
flow
when I
to-
first
to
in
the
'86
head,
treated somebody for
stuff
cancer with
stabilize.
they were receiving
also,
chemotherapy, and it was to smoke some cannabis to feel like a human
at the
being
same
instead of
time
death rolling
cause
over,
cotton mouth.
and to help with
Okay.
not throwing up and to
So-
actually want to eat something.
Something
Topical
and that's a
antibiotics.
terpene,
The
right?
earlier
For me, limonene
Czechoslovakian work
causes, like,
requires
severe
confirmation
cotton,
utilizing
so-
double-blind
but
procedures.
It also increases my awareness.
Anti-anxiety and insomnia.
Okay.
The cannabinoids seem to have sedative, hypnotic activity. They're inconsistent and not comparable to existing medications for that purpose. Sometimes paradoxical anxiety and panic states intervene, and that's we have a way better understanding with the different chematography, the different terpene profiles and stuff than we did back then, right? Yeah. So someone in chat saying when third of a gram. That's pretty strong. That's not too much. Thanks for the math over there. Apologize my poor math at the time. Looking at chat, we have someone saying 6 milligrams per
Didn't give me the answer I was
kilogram,
looking for.
and 60
Sorry.
kilograms
Anyhow.
per person. 360 milligrams. It's
So,
0.36
Annie's-
grams, and their dosage rating
I was
was
really trying to get away from
5
this
to 10
pop-ups.
per kilogram, and 5 to 10 milligrams per kilogram on the mouse trials. And let's see.
Again, tons and tons and tons.
Someone
of
T-Man is
information
stating, when I learned about CBD, I wanted to avoid it, but now I like it.
it's a
And yes,
huge
we were
dive in to
breeding
start
against
reading
it
about, right?
because it kept you
Again,
from getting
we're
high when you
talking
smoked the
about,
flower, and most people were not in for
adults versus children. We're gonna have a different dosages.
smoking
We're gonna have
in the 80s and
titrating
90s
up.
when a lot of this breeding took
We're gonna
place.
have,
And then we found out, like, hey, there's a little bit over here, and they
like,
brought it
juicing
back
a raw
in.
plant is literally the best thing you
Thanks
can
to the help of a lot of folks.
start with.
All
sorts of
right,
things.
so I was reading these ones that they were looking at back then in the day.
What I was looking for
Anti-anxiety
is,
and
talk about
insomnia.
specific plants they're using.
Again,
that's-
we have learned so much more about terpenes and how the synergies of the terpenes and the CBD, et cetera, works together. Muscle relaxant.
Not
The
really
work is,
seeing any
is quite
other
preliminary.
flat out, like
The
we
effort
saw
to
with
determine
what
whether
bounce
cannabis
around
or
with the
derivatives can make
terpene
a
stuff.
contribution
What
to
is
the
this
man,
here?
and so we now know that like mycene is definitely can create an analog muscle relaxant. They're pre-anesthetic. Does not appear that they have any future this
can't read
indication,
that
and
either.
again, they had no clue what the THCA was back then. I don't think, right? And so, as a painkiller and anti-inflammatory, pain, unless new synthetic compounds are found,
There
it
it
is difficult to believe that the
Right.
available cannabinoids compete with current
Cannabis
anaglyptics.
multiple sclerosis.
And so they
Multiple
had,
sclerosis is degenerative
they
chronic
weren't
disease,
utilizing,
nervous
Delta 9,
system.
I've said this all time and time and time
Autoimmune
again.
component.
Delta
Right.
9
Central
will
nervous
make you
system,
friends
I
with your
think,
pain, but it's a
TCD.
THCA that actually kills it.
Autoimmune
Combinations
component.
of
So then that's also getting the entire.
there's also
spectrum
dabbing.
of
They didn't
all,
have
like
any
it's
way to
like
know
the-
you could take those kinds of quantities. It's the different kinds of pain, right? Nerve pain with the
chlorophyll
THCV.
and the anthocyanin, right?
Um,
Minor terpenes and stuff that comes in.
And they didn't want to find out.
Affects the brain and the spinal cord.
Health is more. Someone in
So
chat
someone else
says
said,
health is more than
the
THC
next
and
one that
CBD.
they
Like
said
eating
is-
plants is more than NPKC. Yeah,
The seed of the plant.
industry jargon can't.
Okay.
So much of my shows. Go back and watch
I
all my
have-
shows from the beginning
I'm
to
gonna,
end. If you don't catch
grab
what
something real
the
quick.
most real feel the feel has to say right there. Somebody that's Tony or not? I doubt it could be,
Pop
but
back over here real quick.
let's
Oh, I am-
see.
I'm on that one. I'm sorry. I thought I was. You guys had me there, so I want
Let's
to show you
see.
this.
So back here in the conclusions.
I've been looking at
Depression. This indication has not been
Sorry,
convincingly
folks.
investigated, and no conclusions can be
Still
drawn.
new to this OB
Again, we find that that has to do with your
but I
terpene
wanted to show
profiles,
y'all.
right? If you have depression, you don't want to be couch locking. You want to
So
be
literally, this is
up and
this is what I have
joyous,
on my-
and THCV in there,
my
and
vision
things like
board
that.
on my
THCV also helps with. They don't
And
mention
it
anything
is
here
a
with,
seed press. This is
with,
small,
and
10 ton, 15 ton seed press, right? But
with
my
the,
vision is to mount these on trucks and drive around.
I'm sorry,
wherever
THCV
there's
and,
MC
and
or whoever has
metabolism.
seed and clean it,
THCV,
and
like now we
machines
know,
and
helps
separate out the
diabetics.
But
right? So this
protein
is
in the
1980. Here we are, 40
right?
years
You can get
later,
seed
and
that
even after the
it's
war,
fresh.
the plant's
The
winning.
oil in there as well. You get
Alcoholism and
oil.
drug dependence is
And
not
that's like
likely
perfect
from the
food.
work available at the Cannabis
It's
Group will
better
make
to
a
eat
substantial
than dice,
impact
right?
in
And so
treatment of the
that's one
alcohol
of the
or
ways our
drug
body
dependent
can really,
person.
really
It actually does do quite a bit, replace
You
the
add that, you add
alcohol
some other
dependency,
ancient
replace the
grains,
habitual.
we have lots of
We all know we have plenty of these high mycelium drugs,
make it a whole lot easier for everything else.
Kush
It's-
strains
so let's
that
go
are
back.
excellent opiate replacements. I say I breed opiate replacements, and a lot of the Breath of Dragon series is specifically that. What year is that one? Soul Seeker, U.S. Patent 6630507B1. THC is an antioxidant. Actually, so that one is CBD is an antioxidant and neuroprotectant, right? And that's early 2000s. It doesn't have THC, I don't believe, on that one.
So myelin is like a special kind of like
People are just some people are just about the high, but it doesn't realize it's working for you or
fatty tissue.
inebriated. You noticeably like the THC.
graphic.
One thing is the high is it's anti-anxiety, and so it's medical for everyone.
There's some issues there with
Why should we be low?
and such. Okay, so MS.
What's the point in everyone being low all the
system
time?
attacks the
Why is
protective
being high a
sheath
bad
of
thing?
which
Let's
wraps
see.
the
What,
axons
so
in
with the
your
cystic
neurons
fibrosis, though, what I was really looking for, and I came
spinal
across that
cord,
stuff was,
causing communication issues between the brain and other parts of the
I was
body.
looking at Dr.
With
Traskin's work on
Passing of time, it can cause permanent damage of the
lungs. And so wait, this one here, I
provoking
think, is
disability.
effects of marijuana smoking on lungs. And
Okay,
this
so
is
that,
this
again,
from 2012, I
telling you we really
believe.
wanna
And some of the accumulations of a lot more advanced science. And again, I was looking for some of his work on the vasodilation he did in the 80s.
Spasticity.
But reading through this real quick is the abstract. Regular smoking of marijuana by itself causes
And this is
visible
stuff like, okay, you're not gonna
microscopic
get this kind
injury
of
to large
information
airways.
from
It is
a
consistently
bartender.
associated with an increased
Right? My
likelihood
brain
of symptoms
has
of chronic
this,
bronchitis
insane amount
that
of-
is
that's why I
subside
stop
after
talking,
cessation of
because
use.
so much-
On the other
like, I
hand,
don't write it
habitual
down,
use of
like, where
marijuana
am I
alone
gonna
does
go?
not
But
appear
when
to
I see
lead to
these
significant
information
abnormalities
materials, they see me in
in
chat,
lung function
people's
when
talks, and
assessed with other
boom, boom,
cross-sectional
boom,
and
information
longitudinally,
just comes
except for
instantly
possible
out
increases
because
in
it's
lung
associated
volumes
for me. It's how
and
I-
modest increases in airway resistance
That's how my brain
of
works. It's
unclear
wiring
clinical
again. I can't
significance.
remember names.
Therefore, no clear link
And,
to chronic
this
obstructive
information,
pulmonary
spatial
disease has been established. Although marijuana
objects,
smoke contains a number of
you can walk in the
carcinogens and
forest and go for
co-carcinogens,
days,
findings from
walk
a
like
limited
that,
number
it's
of
like
well-designed
looking at a map, within 100
epidemiological studies do not suggest an increased risk for the development of either lung or upper airway cancer from light or moderate use. Although evidence is mixed concerning possible carcinogenic risks of heavy long-term use.
types of MS.
Let's see.
Okay,
Although
so
regular marijuana smoking leads to bronchial epithelial cilial loss and impairs the microbicidal function of alveolar macrophages. Evidence is inconclusive.
cooking
What that says is chronic smoking
getting that protein
kills your
structure
cilies,
and the fatty
ciliary.
acids,
Those are the little teeny hairs in your
things
lung ways that
you can
help
add
push
into
phlegm to the
try
forefront
and
when we
see if it's
cough it
gonna
up.
help out.
Right, and
A lot
then
of the stuff- I'm
macrophages
I'm not
is
a doctor,
like
I
your
just
large
have this
cell
knowledge,
white
this
blood
plan,
cells and such
when I
that
read
are
these
your disease
different
attackers. Okay, and so this is for
going on in the
chronic
body is
consumption.
what
Right, I consume half a gram, and my greatest quantities was up to 6 grams a day. Right, and I know people say they smoke a whole ounce a day.
So
Right,
there's more
that
in
is
the northern
chronic
hemisphere,
consumption.
less in the southern
Okay, so
hemisphere.
taking
That tells me it has a lot to do with our food,
bong load
right?
or
That processed
two,
food, again, not getting
small
full-
size
that
to
full diet,
effect
full, it-
bronchial
secondary
dilation,
trigger, right? A lot of times there's a late life
to
illness.
counteract
my
a
buddy was 30
blockage of phlegm.
on him. Okay?
I actually do this
Um,
with severe. I'm gonna change. Let's see.
different
I do this
types of
with
MS
severe.
depending on the
I
course of
have
the
a
disease, relapse,
acute
remitting,
sinus
chronic
infection
primary
infection issues where I have
Sclerosis
synergistic
treatments does not have a cure. There are treatments.
antagonistics cause
Help
a
recover from
massive
relapses,
blockage in
control
particularly in my
symptoms,
left
and change the evolution
sinuses, and I've had them do MRIs in
again,
my
if
brain
we
to be
find
sure I
that
don't have brain tumors because of this. And as I learn more and more and more,
it's helping
there's a
with that
histamine
myelin
response
sheath.
and things
I know
like
it
that.
helps with
But
other people. There's other
because
neuron issues
cannabis
that
can
people
be
point
such
to
an
that for
expectorant,
quite a bit.
and I don't know how else to put this.
It's had some amazing.
There's certain
help
strains
for
that I can
people,
use to completely push the shit out of my system by taking
I don't know how they call
a
her,
large
patient
bong
who
load
lives in
myself,
the
okay?
correspondent,
And
some
it sets off the full just you get
had THC
an increase
in it, and
in
she was
all
able to use
of
it
the
to
fluids
base brown
flowing through your body,
without that in the brown,
right?
just being a
And
diabetic,
so,
she
but it's
never
not
did that.
every strain. And so this is kind of stuff I'm
with
pointing
THC, he
to
was able to
with
really
cystic
use that
fibrosis.
insulin
There is a
and-
possibility where actually
And
taking a bong hit
that's-
might
that's
possibly. I'm
for
not saying
diabetic
this is
continued
like.
metabolism.
This is my conjecture
and
from
so
having
think about
a
that again
vast
for
array of
cystic
knowledge of
fibrosis.
looking at the situation.
Probably
Right?
not
I'm not saying go out and
we
do
might
this.
take
I'm
a
saying
quick
this
look
needs
at
to be
it, but,
looked at and could possibly be something that helps. And again, it's not
I
going to
wanna
be
get
every
this-
single
this
kind
is a
of
good
plant.
one to go through here.
I remember Dr. Transky saying back in the day that particularly it wasn't what we would. I try and maintain the difference in sativa and indica because back when this was looked at,
right?
it was very
That's one of the, that's
very
that's
different
a,
in the
a
responses
strong
that I got,
steroid
for
that
instance,
actually
for
degenerates
people
the body
on
itself, right?
the,
And so there's definitely evidence is coming out the cannabis
folks
can be
on
very strong with steroids for all sorts of
on the fishing
primarily
boats,
pain, but
right?
um,
Again, if I gave them what we called indica back in the day, the chronic from the Northern
I've used
Triangle,
steroids for pain.
they would
It
get
was-
sicker.
They used
But
it
if
on
I
me
gave
when they
them the
were trying to
sativas,
figure out
the
exactly what was
tropical
going on
stuff that came to us in the press
with
weed,
my
that stuff made them stop throwing up
severe
immediately
extreme
into
pain.
2 or 3 draws on the
it was
on
like
the
a
joint.
synergistically
smoking
increased
the rope,
pain
okay.
issue from
And
all
so when we saw
spinal
that reading
issues
the
and
information, they didn't understand one way or the other.
nerves and
They
things
just
like that.
and what were they growing for NIDA to research is
Maybe
just
anger
crap,
shit, my
right? They're still
body
using the
was
exact
right,
same
but
shit,
I
and it's
was
all
out of
moldy and
control
stems
at
and
that
leaves.
point, and all of a sudden,
So
I
it
don't like
kind
it,
of sucks
but
that way.
It is what they use at this time, right?
And
Okay, so
it requires
treatment to modify the
more than just people saying
beta
I'm breeding a
inference.
medical plant
I don't
and
know,
I'm
beta-
going for
beta-
40%
beta
THC.
interferons.
That's not like we can make
Lateral
extracts and do all the THC delta 9. You don't need a
fingolimod,
plant that goes any higher with that. We need to find
dimethylfumarate.
like what I showed from the fella in Australia who got a hold of the hardcore, which is a modern polyhybrid back crossed into a gone feral ancient land race.
I'm
Okay.
not even try.
And so what do we get
It's a lot
when
of
that
drugs.
happens is a guy who hasn't been able to hold his hand still for 20 years now is able to read a book
But it
and write
shows
and hold a pencil and draw things and
Different
got
parts
20
of
years of his
the
life back,
endocannabinoidal
okay?
system.
And then we need to figure out
And its
exactly
animal
what it is that's going
So this is
on
newer
in that plant
information because
and identify that and
the
whether we keep it in
endocannabinoidal
plant
system
form
was
or if
first
we can
identified
titrate
about
that in
1992.
for
We've developed more
specific
and more
needs for
information
people's
on that since
nervous
then.
issues.
But some of the first
Okay?
stuff they started understanding is how the brain
Life is
receptors
fractals, in and
the
out.
THC molecule kind of
Sublinguals is a great
Those
way
look like they
for
fit.
it to get into the system. This is true. Sprays,
So-
drops, etc.
Enamide
All right.
was increased
So I'm going to go back here.
in
I started
cerebrospinal
rambling,
fluid
and
and
we're going to go back into the
plasma.
web browser though.
MS
And
patients in remission.
finish up with
Cannabinoid CB
So-
1R and CB.
I guess the other thing I was going to hit on there is we do know now that there is some antibacterial. And I was talking about the carriers, the PG and the PAG. I'm sorry, that's what the PG 300. So I'm sorry I was stumbling on that shit earlier. That's how the brain works
It
sometimes.
is affected by the MS.
But those are those clear carriers
And
for
so if it's-
vaping that I was talking
if
about. They're
it's depleted, it's
antibacterial,
probably easier to
antimicrobial,
more easily
and if we can apply these effects from the cannabis along with
makes it
a
a complete
vape
system.
cartridge carrier and you're vaporizing it, you don't even have smoke, you can still get that release of phlegm and the increase in fluids and the expectorant that goes on with it. So usually when I was discussing, I've got to do a whole lot. I got to drink some water. It helps me immensely to clear my sinus and everything. But I had to stop drinking all alcohol because of that, unless I take a pill beforehand. So.
Delta 9. And
So the evidence is mixed concerning possible
A
carcinogen
is greater
risk of heavy long-term use.
than the
Although we really don't know,
combination of
it doesn't
CBD
show
and
up that
THC
people
9.
with I don't know people
Right.
would get lung cancer.
And
You don't
so
hear
when
about
you
that.
combine all these
Um,
together,
Regular marijuana smoking leads to bronchial epithelial loss, impairs microbial function of alveolar macrophages. The evidence is inconclusive regarding the possible associated risk for lower respiratory tract infection. Several case reports. So for me, with that stuff, I stopped sharing my pipe in the wintertime, and I stopped getting lung disease. Straight up. Like, I'm going to keep wearing a freaking mask in public. I don't care what y'all think. I like being healthy, right? And like, sharing pipe is one of the biggest things, and that's something I think that's confused in long-term use studies and over time with lung disease. Sharing the pipe, you end up getting bronchial infections from other people. Okay, and when I observed that about 4 or 5 years ago, my winter lung crud went. We used to always get like a 2-month virus in the wintertime from one of the other skiers that you shared your pipe with. People are lying as to what it is. So these are real observations. Oh wow! So there's a time. Again, I'm not a science. I'm not doing science on this. It's not necessarily bro science, but it's recreative cannabis. They're real observations from long term and administering this as a medicine. Led to the first study of cannabis in MS. So I'm down to 6 minutes. I want to read the rest of see this lung thing. Several case reports have implicated marijuana smoking as an etiologic factor in pneumothorax, pneumonia. It is and bolus lung disease. Okay, so that's what I just said. Although evidence of a possible causal link from epidemiological studies is lacking. In summary, the accumulated weight of evidence applies far lower risk for pulmonary complications of even regular heavy use of marijuana compared with the grave pulmonary consequences of tobacco. So that says, like, it doesn't even compare with tobacco being bad for us. And again, my observations and my understanding of the plant is in total jargon and scientific use spit out right there as saying that, don't smoke it all the time, but this might be a freaking cure for people having this issue with their lungs being full of shit from cystic fibrosis. All right, and hopefully the right person hears me this. I know I'm talking to one person specifically, literally the father of a child with this condition, who asked me to help him out a little bit and understand how this plant works. So I get 1,000 views of this, and the information might go into the right ear, that it goes into the next ear and into the next ear and gets to where it needs to be to find the answers. So that's the best we can hope for. And other than that, you were entertained listening to me ramble. And not sure if there was really a whole lot else I wanted to bring up today. Let's take a look here, though, real quick. Regeneration of myelin sheaths in the nerve fibers. Look at the chat. We got Loyalty, Brian posted, and AJ on the studio view. Mediated by the activation. Chat's rolling through. I have no idea how many people are watching live right now. AJ's on both sides, along with Ray's and Jane. You got Joshua Patio, Fried Piper, Soul Seeker, Squishy Mears in the house. Appreciate y'all. Jamie Reams saying, "Hey, it's up." So there's way more potential than we've been able to study. What's on the view there? I'm sorry, you guys are looking at that abstract. Transition back to my ugly mug. But there was something else I was going to bring up. Let's look at. I don't know if this is going to come up for us today. Here we go. Yeah, that's the one I was talking about. We'll start right here. Transition back to that one. So this is what we're looking for. We're looking to help people. I think just this is health. Quick, so I touched the beginning of the show talking about my friend has a number of health issues, one of which causes him to have severe tremors in his hand, leaving him unable to do anything, requiring precision, let alone hold a cup of tea. I give him a hardcore Earth Fuel Pheno to enjoy, not thinking much of it. He tells me that it has reduced his shakes almost completely. He can roll a joint, play 8-ball, and use a knife and fork. In his words, it has taken back 20 years. This is what makes growing NMS so true. Just so true. Here's today, and coming to a whole new whole new level of understanding the plant and listening to Frenchie and learning from folks. Right, I started understanding how to breed a better plant for making solventless extracts. And here's a slurry cane by Breath of Red Dragon, calling it the Red Hots. Results of some of that. I don't know if it gets. This is completely jar tech. Absolutely no
what that neural effect was.
no heat applied beyond the 65
So,
degree room temperature,
talking to
and in and out of the freezer
everybody there
3
and
times.
Here I am again.
And I did a quick whip on that to show.
Yeah, so
This is from
a
my
big,
new
big, big,
first
huge,
familial
huge
feminized,
picture
or the
that,
breath of
like,
red dragon.
when you add
Number
up
13 reversed
so
into
what
a
are we
couple of
coming
the
into now?
elite
38
polyhybrids
years.
that I found could use some improvement in
Is
various
that it since '85?
various levels. So this was fresh
84
frozen,
when I
and that's the
first
very best I've ever produced is from the fresh frozen. This is what it looked like a couple of days prior before it really started breaking down.
'86 with cancer.
There's
Right, so we're coming into
what some of that plant might look like.
I got some knowledge, but how
I wonder.
I applied
Oh,
to be
that's
the
just
state's
advertising
cannabis
us here.
expert, and they said they had someone
So,
qualified. And I think it's just because
anyhow,
the Microsoft.
yeah, this is
this
is the second wash of that
but like
in
so
cabochon,
much
and that's
more
before it
information I don't
completely
even
transitioned. It was just
right?
starting
There's
to
so
push
much
its
more being learned, right, and so hopefully
terpenes
I
out of
found
it.
this middle ground for folks
And
who
the Instagram
are trying to reach out or
scammer, yeah,
come
you know,
out,
anyone wants to
or
go
just
harass
because
this
of
guy,
or
he
still is
charged
in
my daughter
prohibition.
$200
And
to
I'm
get
able
her
to exercise my First
Snapchat
Amendment
back
right on
and
several
ripped her
levels
off.
here.
Clinton
federal
Tech
right
78 on
First
Instagram.
Amendment in the background.
Anyhow, we're
From
looking at
Congress
medicine and
in
not trying to hate on
2000.
anybody. Look at my daughter. I told my daughter how many times I've been ripped off. Like I
Sacred Earth.
got charged $100 to have my
This is
truck
me. There ain't no change. from that. Nobody
detailed one
is
time, and
nobody
they
gonna
charged me
deny it
$1,000, and I didn't see it for 2
who I
years
am.
because I was working so hard and making money back then.
I'm able to
But this
help
one here
you
is
out, help
it's
yourself.
recrystallized at this point, and where you can see it right now, it's literally just putting off the
Grateful
terpenes
that,
and
PhD
transitioning
was
out,
able to
and now
help
it's
me
all
out for that, and I
recrystallized.
hope he's doing well.
So I'm right at that 1 hour mark, and appreciate y'all stopping in. I'm gonna go ahead and just keep my time frames
Let's see if I can
intact.
bring the chat up over
and,
here.
We're gonna sign out.
Appreciate
you.
everybody,
Have a great day.
on the home channel checking out the studio feed. And people wonder sometimes why I read the whole thing. I don't know if I mentioned this before, but it's definitely we got people who are driving their car listening to this, who are trying to fit it in when they can, who are busy trying to provide for their families or whatever it is, and heal their children or their parents or